One of the most effective ways that community health nurses can impact the health of populations is through the use of programs. Program management is incorporated in the competencies and standards for public health nurses. Many of the programs that public health nurses are involved in are well established. For example, programs focusing on immunizations, school health, child health, or communicable diseases. However, there are instances in which a need arises or a problem develops in a population, and there is no established program which quite fits the situation. In this scenario, the public health nurse, likely as part of an interdisciplinary team, is faced with the prospect of either adapting an existing program or developing a new one. In the context of community health nursing, a program can be described as a collection of activities that focus on health issues or on health determinants in order to effect the improved health of a community. Inherent in this definition is the idea that developing programs involves a series of processes. Working through these processes is known as programming. In its most general sense, programming parallels the nursing process. Assessment, resulting in the identification of a health need or concern, analyzing the need or concern and developing goals and objectives, planning a program to address the need or concern, including how the program will be marketed, implementing the program, and then evaluating it. Ideally, the program's target population will be involved throughout as an active partner. To illustrate how programs can be developed, delivered, and evaluated, as well as the challenges and rewards inherent throughout, we will examine a program which was developed in the early 1990s in the St. John's region of the province of Newfoundland and Labrador. This program, called the Healthy Baby Club program, has been adapted and expanded as an important part of public health nursing practice to over 50 sites throughout the province. Throughout this video, the Healthy Baby Club program will be used to demonstrate the role of the public health nurse in programming. The Healthy Baby Club is a pregnancy support program which aims to increase the possibility of a healthier pregnancy. It is a creative program responding to the needs of women with limited resources. The Healthy Baby Club is located in the community, usually in a family resource center. It provides not only group support to pregnant women, but also individualized support through a peer support person known as a resource mother. The resource mother is from the same community as the program's target population and receives special training to help and support others. The resource mother is critical to the program's success.
As a resource mother, we're the primary contact with a participant. I'll telephone them and we'll set up a place or a time where we can get together and go over what we call a get-to-know-you form. So we go over all kinds of different history, whether it's medical history and family and all that kind of stuff. And then once that's done and we actually come to group, myself and the other resource mother, we're responsible. Pretty much we don't run the group, but we get the snack. And we're here to open up, we set up, we answer questions when we can, direct them to somebody else when we can't. In between meetings, we call our participants. Every week we make contact with them just to see if they want to come to group or if they can come to group or if they can't come to group or how you're feeling, just basically call and touch base.
I think one of the big strengths of the program is the peer support that's offered through the resource mothers, and they provide such great support to the participants from the initial contact and being a friendly, welcoming face, someone who helps explain the program, helps to bring them in, and has the contact with them throughout, and helps reinforce the messages that are heard, and helps them sort out some of the things that they need help with, and just helps keep them participate in the program.
In addition to the resource mother and group support, other important activities of the program include the provision of food supplements, cooking sessions, home visiting, prenatal and childbirth education and support, postnatal and parenting support, and many types of informal support. Public health nurses were initially involved in the conceptualization and development of the program. Currently, public health nurses do not manage the Healthy Baby Clubs, but they remain an integral part of the program as they work alongside the other members of the team, such as nutritionists, program staff, and volunteers. They also work closely with resource mothers and participate in the delivery of the program. Public health nurses sit on the Provincial Healthy Baby Club Advisory Committee, which guides the development of Healthy Baby Clubs. They also have been involved in the ongoing evaluation of the program. Let's go to the beginning phases of program development. That is the assessment and analysis phase, where the health concern or issue is identified and rationale for the program is given. How was this determined in the case of the Healthy Baby Club program?
I was one of the people who was involved in the committee that came together to develop Healthy Baby Club as an alternate model to providing prenatal education and support for high-risk women in the community. We had the two options for women at that time who were pregnant and who were high risk. And by high risk at the time, we identified that primarily as women who were living in poverty. Most of those women were going to either, or were referred either to prenatal education in the traditional hospital-based prenatal classes. That was not working. Most of them were most of them were not going at all, and if they were going, they went for very short periods of time and left quickly. We then offered an alternate model, which was, I remember it was a Wednesday afternoon in an old building that we had in the downtown part of the region, that we offered prenatal education specifically for that target group. And while attendance was better than it was at the hospital-based classes, it was still not good. And so we knew that this was a group of women whose needs we were not meeting, and we had to do something different. So at that time, what we did was we brought together an advisory committee. The advisory committee was made up of, from community health at the time, it was myself and the regional nutritionist and one of the nurses who was frontline public health nurse, as well as a private community nutrition consultant. And we came together most particularly with that group of professionals who were involved. We also involved directly a number of the women who had either been referred to hospital-based classes and not gone, or who had, who were currently pregnant and who were had an opportunity to attend prenatal education and were not going at that time. And we did a number of things with them, asked them what worked for them, what didn't work, why they didn't participate. So we looked at what were the things that could encourage participation and what were the barriers that prevented participation as well.
One of the challenges is that many of the participants have complex needs and all kinds of issues in their lives that they're dealing with. So some of the strengths, I think, of the program are that it's been able to help remove some of the barriers for people to actually participating. So by providing things like transportation and child care, providing food supplements, from a nutrition point of view, that's been a really big thing, because prior to Healthy Baby Club, when we do prenatal education, it would be the public health nurse, talking to people about what they should eat. But, knowing full well they often didn't have the resources to be able to buy the things that were being recommended. So at least now, in combination with education and people learning about what they need, they're also given some resources to help fill in some of the gaps in what they wouldn't normally have.
Not only was a health concern identified, but also the target population to be served by the program, a population with a large percentage that is impacted by poverty and all of its ramifications. Other key characteristics of the target population include a high percentage of participants being in the early adult or teen years and of single marital status.
Many of the young women who were candidates for Healthy Baby Club had experiences in school that were less than positive and equated going to regular prenatal education like going to school. And so we didn't want it to be anything like that. So we wanted to create an opportunity where people could come together and actually have fun learning. So it's based on an adult learning model, and a lot of, instead of a public health nurse standing up and giving a lecture on health